Let's talk about a deeply emotional but important topic today: miscarriage, also known as spontaneous abortion. This happens when a pregnancy ends on its own before 24 weeks. Sadly, it's more common than most people realize, and it often brings feelings of sadness, guilt, and confusion. Around 90% of miscarriages occur in the first 12 weeks of pregnancy, and they are more likely as a woman gets older, especially after 40. In most cases, the cause is chromosomal abnormalities, meaning the sperm or the egg had genetic issues that made it impossible for the pregnancy to continue. Other risk factors include smoking, alcohol consumption, certain medications such as ibuprofen, medical conditions such as diabetes or thyroid disorders, fibroids, and exposure to X-rays or chemotherapy. Signs of miscarriage usually starts with vaginal bleeding, which may be brownish at first, followed by cramps and the passage of tissues. Some bleeding may stop on its own and the pregnancy continues, but in other cases, the miscarriage progresses. If you notice vaginal bleeding, see your doctor immediately. An ultrasound scan will help confirm what's going on and rule out other conditions such as ectopic pregnancies. There are different types of miscarriages. In threatened miscarriage, there's vaginal bleeding, but the cervix is closed and the fetus is still alive. In inevitable miscarriage, there's painful vaginal bleeding and the cervix begins to open, leading to a miscarriage. In incomplete miscarriage, bleeding has already occurred. However, there is still some pregnancy tissue remaining in the womb. In complete miscarriage, all the fetal tissues have passed out and bleeding has stopped. In blighted ovum, there's a pregnancy sac, but there's no embryo within the womb. In missed abortion, the embryo has stopped developing, but there are no symptoms of pregnancy. In septic miscarriage, an infection has developed, often after an unsafe abortion. Treatment may involve medications such as misoprostol, manual evacuation, and antibiotics to prevent infection. Healing after miscarriage takes time. Lean on your partner, talk to your doctor, and consider speaking with a mental health professional or spiritual guide. Your doctor may recommend waiting 1 to 3 months before trying again to get pregnant and taking folic acid during this time. The good news, most women go on to have healthy pregnancies in the future.